Hey, everybody. It's great to be with you again. And we're so happy to have another Dr. Judy. How many Dr. Judys are there? That's my first question. How many great holistic naturopathic type doctors are Dr. Judy that we need to know about? We need to have on this show. But Dr. Judy Jasek, she is really an amazing person.
Maybe we should start the Dr. Judy Club or something.
We'll start the Dr. Judy Club. Yeah. What we'll do is we'll create a playlist of just Dr. Judy's in our YouTube channel.
There you go. Have Dr. Judy Week or something.
Dr. Judy Week. So everybody, Dr. Judy Jasek is really an amazing, enlightened veterinarian that is very interesting. When you go look at all her podcasts with Dr. Karen Becker, Dr. Judy Morgan, she's really an expert on nutrition, on cancer treatment. We're not going to go into cancer, although I absolutely would love to. Where I'd like to go, Dr. Judy Jasek, is let's go into your animal healing arts program that you have. And what this is, everybody, is it's a way for pet parents to take ownership of their pet's health, be educated, and take an active role in their health, and not just farming it out to a veterinarian that you find that you like. And where I'd like this conversation to go is this the future? I mean, you look at all these different amazing veterinarians that are using platforms really, really intelligently. Is this the future of veterinary medicine? So let's start there, Dr. Judy. Can I just call you Dr. Judy?
Oh, of course.
So let's start there. If you want to comment on the state of veterinary medicine, where it's at or where it has been and where you think it can go, that's where I'd like to start this conversation.
Great. I love this topic. Because I think it's so important because I think, we were talking briefly before that we need a paradigm shift. I don't think we can focus on fixing the system. It's like, I think Buckminster Fuller said something like, you can't, or I'm paraphrasing, but, like kind of don't waste your time fixing a broken system, create a new system that makes the old system obsolete because it's so much better. That's where I see we're at in veterinary medicine. I just feel like I butt heads with veterinary medicine all the time. It's like, sometimes I think, why am I even a licensed veterinarian? I don't live in that world. I don't participate in that world. And I think it's because there's different mindsets. I think a fundamentally, like a couple different ways to look at disease. And I say dis-ease, like an imbalance in the body. I'm much more a believer in the terrain theory, where if we keep the body healthy and the body knows how to be healthy, health is the natural state of the body. And if we support the body appropriately, it will regain that natural health and homeostasis. Where conventional medicine has gone, it's like it's algorithmic almost. Veterinarians are, I recently went to a conference, and it was a conventional conference, which I don't do this very often, but I needed some CE credits, and I didn't feel like flying across the country. So I went somewhere where I could drive a few hours, and it was so awful for me, being like, the energy was such a, it was like, this isn't education, it's programming. And that's exactly what's happening. Is the vets are programmed to diagnose. They can't treat. They cannot. Conventional vets, for the most part, I'm making generalizations, but for the most part, what I see, vets don't look at a patient and treat the patient. They treat the diagnosis. Until they can name something, they don't even know what to do with the pet. So they run the blood work. They're treating the numbers on the blood work. They're not looking at the pet. They're not having this conversation. Well, what's going on with Fluffy, Mrs. Smith? How long have these symptoms been going on, and what's going on in your household, and are there other stressors, and what's Fluffy's diet, and what's the vaccine history? I mean, I have hour-long consults with new clients because I ask all those questions, because it's all important. Then we get the whole picture of what's going on with the pet. And quite honestly, I mean, yeah, the blood work, the diagnostics can be helpful, but I don't need that stuff to get started treating a pet. I listen to the history, what's going on. What is the owner seeing? They're the most valuable part of the picture because they know that pet better than anybody. And what did veterinary medicine do during COVID? They won't even let the people in the building. I talked to somebody, a client yesterday, said she still cannot go in the clinic with her pet. They never reopened after COVID. So there's this separation. And I thought, that's such a valuable part. It's like it's a triad between myself and the pet parent and the pet. The person, the people in that pet's life know that pet better than anybody. So I want all that information, and then I can put that together and I say, then how can we best support the pet? Not how do we suppress the symptoms or how do we kill the cancer? I work with cancer. And in the conventional medicine, it's you do chemo, radiation, or surgery. That's all they got. People don't want to do that. They're like, sorry, take your pet home and watch it die, I guess. And that's literally what people are told. I look at it like, how can we support this pet's body so that they can manage this condition? Maybe it doesn't go away completely, but maybe we can stop it in its tracks. Or maybe we can, I've definitely seen some, regression in cancers. It depends on our starting point. We were saying before, sometimes pets are so, damaged from their history that we're starting pretty far behind the ball, and it can be hard to make up for that. But that's where I start. And that's where I think we need to be thinking about health in human medicine and in veterinary medicine, is how do we regain that natural state of health and homeostasis? And then they're good. They're healthy. Like we don't have anything to treat them because they're going to be healthy. But it's a huge shift. And you can't in where I'm at, what I'm seeing in the profession, I don't think you can integrate those two. We have to start a whole new paradigm and get the people that want to come over to that paradigm and that way of thinking. And sometimes there is a need for conventional medicine, true emergencies, a broken leg, hit by a car.
Sure.
Those things are necessary, but I think it would be, if I were younger, I was more ambitious, have a clinic where you can offer those services, but it's from this more holistic perspective, but people would have places where they could go to get those needs met. And then the pets are supported, holistically afterwards. I think that'd be great. I don't have the ambition to go there, but I'd love to support, a project like that if somebody younger wanted to ever take that on.
Hey there, this is Rob Ryan. I just want to say how much we enjoy making this content for you here. And if you are enjoying it, would you like our video down below? And would you subscribe to our YouTube channel? It sure does help us get discovered by more people like you who need information like this. And also down below in our description, the top link is to our trial pack. We hope you'll order one for your dog so your dog can have fermented superfoods that give them nutrition like they can't find anywhere else. Hard to get nutrients that are easily absorbed. Thank you very much. Now back to the show. Well, it's so many things came into my head when you were talking about surely there are great vets out there all over the world, but the model for bringing new vets in to the world is flawed, and everybody knows it. This is not a new topic at all. we've been talking about this for over 2 decades. Who funds the vet schools, who pays for the veterinarians, who pays for equipment, who gets these veterinarians started in practice. I think as indentured servants, some of them, they're indebted to these companies, and these are big food. These companies own the whole model from food, health, insurance, and death.
And the vet clinics. It's all like a big conglomerate. Yeah. They own,
the big
corporations own it all. Yeah.
Yeah, it's the same thing in all kinds of verticals. big food, big ag, big vet, you know.
Mhm.
So what it's our responsibility to find veterinarians who believe in wellness, believe in health, believe in the innate immune system, believe that with if you can give the body what it needs, and you can look at deficiencies, you can look at things that are getting in the way, like, toxins, or, hey, how about you get that, plug-in air freshener out of your house, all of them all over your house, or
Yep.
whatever, and who can actually think that way. That is, then we don't have to, pack on medications and therapies. And the best vets I've known never want you to come back unless you have a problem. They want to free you
Yeah, absolutely.
from, they're not trying to take your money all the time. And, and they're making a great living. I mean, the really great vets know how to make a good living. Now, the corporate vets, if they have a big factory going, it's a pretty good business, and then they want to get bought out, and there's a whole
Mhm.
thing. But what's curious to me is that you ended up calling your business Animal Healing Arts. So, how much of veterinary medicine, in your opinion, is an art?
I think all of medicine is an art, and it should be. I think it's not practiced that way on the conventional side, but it is an art. And there's because I don't believe that there's one size fits all um, treatments. You don't look at a pet. Again, if you're treating a diagnosis and then you plug that into your computer program and say, okay, here's this diagnosis. What are my treatment options? That can be done without even looking at the pet. But when we're looking at the pet, it's like puzzles. It's like putting a jigsaw puzzle together, which I love to do that too, where you're putting all these pieces together and all these pieces of the history, and again talking to the people in the pet's life. And it's like a dance between the practitioner and the pet and the people, and we look at the history. And like, perfect example is itchy skin. It's the hardest thing to treat, in my opinion, because I could take 20 dogs with itchy skin. Every history is going to be different.
Yeah.
Every set of circumstances is going to be different, and every single one is going to have a different solution. And that's what makes it really tricky. What does conventional medicine do? What am I apical? Just suppress the symptoms. It just suppress that immune system reaction, and the symptoms go away overnight. And people aren't up at night listening to their dog itch, but a few years on down the road, they're going to have that cancer diagnosis. So I put a lot of thought. I really like the fact that you brought up the name, because I really put a lot of thought into that about, well, what does practice mean to me? And I do really believe it's an art, and each practitioner is an artist, and we all have different skills. We have different techniques. Certain modalities resonate with us, so we use those. And then if somebody wants a different modality and like, that's not really my thing, well, I will refer to another veterinarian. I mean, I believe in abundance. Let's all come together and help pets as best we can, and use our gifts. Practitioners have gifts, and practitioners should be allowed to use those gifts in the best way possible, and in the best interest of the health of the pets. So I do believe it's an art. And I think if we could regain that, it's so sad to me that I hear that the suicide statistics in veterinary medicine, veterinarians are committing suicide. Like how tragic is that? We're the animal doctors. You should love this work. And I think it's because we've gotten away from that, and so many vets are trapped in these corporate practices. They're not allowing themselves to, they're not being allowed in their practice situation to express their art form and practice authentically, because they have to follow the corporate protocols, and they have big student loan debts, and they're trapped. And for me personally, there's nothing worse than feeling trapped in a situation where you don't have an out.
Well, the private, I've said this before, the private breakfasts and lunches, dinners that I have with great, great veterinarians, they have privately told me, and I won't divulge their names, but they've privately told me, yeah, the same thing you just said, which is, you go into veterinary practice because A, you love animals, and B, you're a problem solver. You like a Rubik's Cube, you like a puzzle. And then when that happens is you essentially get put into a practice where you're painting by numbers, or it's these, as you put it, algorithmic. It's an if-then statement. If this, then this. And so then what ends up happening is you see that these animals end up suffering longer term, or the problem isn't resolved, and there's these side effects that may or may not come about. And you realize, like, all you are is a button pusher, and you're not in the career that you wanted to be in. And you're also, PS, by the way, having to put animals to sleep, and you're seeing all of the downsides without any of the upsides of the healing and the beautiful life that you're giving animals, the things you get to see. So it's absolutely not a big mystery to me why vets are committing suicide. Then you have the financial pressure of it. And, I think we've said this on podcasts before that, if you're a vet, or you have a vet in your life that's a loved one, or you're working with a vet that is dissatisfied, show them this podcast, show them another way, have them reach out to Dr. Judy. Have that. Dr. Judy, would you love to hear from a conventional vet that wants to change their practice?
Oh, that'd be my dream. I'd love to do that because, I'm just one person. I can do just so much. I would love to shift from working one-on-one with clients, which I do enjoy, but how many people can I realistically reach, and for how long? I'm not getting any younger, but if I could reach the vets and I could get more vets doing this, well, then I'd be serving so many more people, and the veterinarians would actually enjoy practicing again.
Yeah, right. Well, it's inspiring to be able to, help somebody who's found themselves in a situation they don't love. And you're right, you're going to end up affecting many more dogs and cats and bunnies and birds and whatever else it may be. The other thing, so AHA stands for Animal Healing Arts, and then it's vet.com. So,
correct.
So there, tell me, really, just give me your couple sentence spiel on what that is when people go to it, a pet owner.
When they go to my website?
Yeah.
Yep. So I'm doing telemedicine currently. I don't currently have an on-site clinic. So people go to the website. We are a private membership association, and I won't get too deep into that, but basically that allows us to practice in a more sovereign way. Should what I do become challenged, it's like a private club. Our clients sign a membership agreement so that they're saying they agree to follow the philosophies or how I practice. They're coming to me for this kind of help. And then I have Are We a Good Fit video, because I've gotten to the point where I want to work with people that are really willing to go hardcore holistic. You can't, I'm interested in feeding some raw food, but I'm still going to feed some kibble to them. Nope. I just don't work with people like that. People have to be willing to do the diet change, and they have to be willing to be open to change. If they're going to, just want to keep, a lot of people are on the fence. They want to keep 1 foot in conventional, 1 foot holistic. I want to work with the people. They're saying, no, I've seen conventional, great for emergencies and very short-term care. Definitely a place for it, not for long-term care. And I want to work with people that are willing to, move completely away from that and say, no, I'm going to do everything more holistically. And so I put a video out there kind of explaining our philosophy so that people know whether we're a good fit. And if they're not, great, go work with somebody else. I don't have any shortage of clients, but I really, like I said, I don't want to be working in both worlds. I want to move into the holistic world and work with people that only want to be in that space.
Yeah, good for you. And how are you going to do your best work if the foundation, which is nutrition, isn't right? I mean, then you're kind of getting trapped in this pharma model of, whack-a-mole, the
Mhm.
whack-a-mole game. You're just a head pops up and you hit it back down again. Where a lot of those things could be resolved with just a really good diet. For us at Gussy, we don't, we get questions like, is this really good to make a kibble diet better? We get that question quite often, and we say, no, we don't. That's not what we do. There's a greens company that will remain nameless, but one of their big marketing, angles is they talk about how brown food is dead food. They're referring to kibble,
Mhm.
and that their product livens up the dead food. Well, that's not very legitimate. It's not honest. It's
Mhm.
not fair to the pet owner to, what they're doing. It's marketing. What they're doing is they're taking they're making a smaller leap from where a customer's at to where they want them to be to purchase their product.
Right.
What we require is a bigger leap. We're not interested, like, for us to be successful as a company, we have created a model for our company where we don't have to have tens of thousands of customers that buy our product in this mass way. We don't have to be on these websites like Chewy or, all these other, big corporate stores. And what we're interested in doing is healing pets. We're not interested in just selling a silly green
Right.
powder. So,
Right.
we're in the same business, I think, which is, what we're asking more of our customers. We're asking them to be a tiny bit educated, which is why we do this show on our YouTube channel. We're asking them to be informed. We're asking them to take an active role and an interest in their pet's health. And unfortunately, uh, just as much as your human child, cannot be uh, uh, handed over to the Western medicine model, neither can your pet in the Western veterinary model. You need to really be interested in good nutrition, good healthcare, good lifestyle management, exercise, all of that stuff. You do need to be interested. It's just the way it is. It's a
Yeah.
living being.
Yeah. And you have to start with that foundation. I mean, I agree 100%. If you don't start with that nutritional foundation, there's just no way I can help the pet. And that's why I just won't
Yeah.
work with those people. I had a potential new client that I think moved on, got really upset because she said the only thing it was a cat, the only thing her cat can eat it was one of the Royal Canin prescription diets. And I said, you know what, if you're not interested in even having that conversation about getting and working towards getting your pet off that diet, then sorry, I'm not going to work with you because I'm not going to be successful. It's like, I want to eat at McDonald's 3 times a day. What's the vitamin I can take that's going to make that healthy? You can't fix poison. That's what I say about kibble. You can't fix. It's so toxic and so inflammatory. There's not a single supplement or 100 supplements that are going to fix that. And
Yeah.
why buy all those supplements? Just feed them the right diet and they're going to be, so much healthier. And people say, well, they can't afford it. Well, have you looked at the price of treating cancer? Not to mention the heartache.
Yeah.
I mean, make your choices.
The delta between where they are and you are is too great. And that's how we feel. We're not interested in marketing and, frankly, tricking somebody into buying our product thinking it's going to fix it, because usually those are the customers that we have great customers. We have like a real, if you look at our customer support statistics, they're ridiculously under what a company that over markets and oversells and over promises what they are, what they have, and the kind of questions and then you end up having angry customers because what you did is you promised that your product would end up stopping itching or stop the allergies. Or, I mean, how many times are we on Instagram and we see these, these like scare tactics being used with like, you see like parasites images overlaid on a dog's gut, and you're like, oh my God.
Fear is a great seller, and it's used all the time. That's how they sell. That's how they sell so many dangerous, toxic products to pet parents is fear.
Yeah.
It's a very powerful motivator.
Yeah. So I think that we believe in a very similar thing that you do, which is you've got to meet people where they at. But there's another expression for that. They call it the existing listening. And I like that because it doesn't mean these other folks are dumb or, behaviorally, they've got some, issues that we don't want to deal with. No, they just haven't come around yet. They haven't gotten the right information or been turned on to the right information yet. Mm-hmm. And so I like to say the existing listening. So our customers, your customers at Animal Healing Arts, those are the existing listening, and they're coming to you because they get it. They're at a current understanding that this is what they have to reach for in order to get really, really high quality care for their pet.
Yeah. And I'm once people turn that corner, like I'm all in. I'm more than happy to help them. I'll educate them about maybe what's gone on in the past, but not to make them feel bad, but just for them to realize, to help them connect the dots. Because that's what I do when I look at a patient. Like, I want to know, where did this come from? Why do I think this particular pet ended up with cancer? And I try to, like I said, put those puzzle pieces together, because then we can learn more about preventing it if we can understand where does it come from. And I do that with my clients. And I try to do it gently. I don't want people to feel bad or guilty, but I want people to know so they can do differently. And what frustrates the bejesus out of me is when I know people have learned and they know better and they just won't change. You've been doing this the same. How many courses of chemo are you going to do? They keep going. It came back, really, no kidding. The cancer's back because you just wiped out their whole immune system, bottomed out their white blood cells, and you wonder. And they were all excited because their pet's in remission, supposedly. And then the cancer comes back. Well, yeah, it comes back every time because they got nothing left, to fight with. So for people that just want to keep getting one more course, they got stronger drugs, they got more drugs. I'm like, you're just killing the pets. And that's what I'm in it for. I really am in it. I'm in it for the pets, I have compassion for the animals, but compassion for the people too. But I'm really in it for the pets. And so I'll be a little, animate about who I will and will not work with, because I want to see my patients thriving, not just surviving. People say, oh yeah, I had dog fed kibble for 15 years. Okay, your dog lived 15 years. What was its real quality of life? And and I'm sure you guys have heard this too. You take a kibble fed dog that seems okay, they seem pretty healthy, and you take another dog and feed them raw, and you compare the two of them, it's going to be night and day. But it's not like that kibble fed dog might not be, sick or have symptoms, but their health, the vibrance. I want them thriving, not just surviving. I actually had a client, I was talking to like a 6-month-old Labrador on a raw diet, very minimal, if any. They might not have even vaccinated this dog at all. If they did, it was very minimal. And they said, compared to my neighbor's dogs, my dog's energy is just like, it's just off the charts.
Yeah.
Like, is that normal? And I'm like, yeah, it's normal. That's the way dogs are supposed to act. They're not supposed to be, dumbed down, these poor dumbed down, toxic, malnourished creatures. They're supposed to be that vibrant. I have a 5.5-month-old German Shepherd puppy who wears me out because
Lucky
he's
you.
just got endless energy. But I love it. I love seeing animals with that degree of health because it's not about just surviving. It's about thriving. And that's what I want for my patients. And when the humans I'm working with put up a roadblock that I can recognize and say, I'm not going to be able to achieve ultimate health for this pet because of this person's perspectives. I really struggle with that. I hate to stop working with people or turn people away. But when I see that roadblock to helping a particular pet live just an ultimately healthy life, that's really frustrating for me.
Yeah. Well, my dog Gus just turned 7, and I hear this all the time on this walk we do. It's off leash, big walk, and you see a lot of happy dogs are off leash and they're excited. And people always, I mean, at least once a day, if not multiple times, like, oh my gosh, how old is he? And I say 7. And they say, what? And they think he looks like a puppy. And now what I do is I lift up his chin a little bit. There's a little bit of white that's happening. Like, prove it to them. But he's so thin. He's, this dog eats like almost 1.5 to 2 pounds of raw a day. I mean, that's a lot. Don't you agree that's a lot?
That's a good amount. Yeah.
Good amount. And what is he? 50 pounds.
Yeah, that's a lot for a 50-pounder.
It's a lot. And he's intact. That's a big part of it. And you can't I have to occasionally give him things like sweet potatoes if he's exercising too much, and I have to add a little bit of sweet potato just to keep his weight on. I want to keep him at 50. But he's so lean, and he's just so. I'm obsessed with anti-aging, so that's what I focus on, and health and detoxification and all that. And it pays off, and I see it every day in my life. And I always think to myself, well, what is it you expect with your dog? Why can't you have this? And I want to tell people that, imagine if you just ate cereal every day, or the way you feel. I don't know. We'll just use an example of you went out to a party. Maybe it's a Christmas party now that we're in that time of year, Thanksgiving party, and you ate a bunch of, junk. It's a party food, fun party. And then you maybe had a couple drinks, and the next day you just don't feel great. You don't want to go out and go jogging, or, you want to lounge around. But what if that was your dog's every day?
Yeah.
That's what you're talking about. You're talking about feeling, you can't see that. This is all that this is your dog's way of living. And what if you could have a dog that actually felt great, that ate really great food, and I know a lot of people that their dogs eat better than them because they personally don't want to eat that well, but gosh, you could give it to your dog. They love it.
Yeah.
Give your dog the life that you don't want to live.
Yeah, at least do it for your dog. Yeah, if you won't do it for yourself, totally.
Yeah. So, well, this is very interesting. So this is a membership of yours. And so people can actually start to take a really active role in their pet's health in this membership, and they get one-on-one time with you.
Yep. I do one-on-one. It's all, like I said, it's all telemedicine. We do phone and Zoom, and it's auxiliary care. I mean, people still need to have a primary vet. They still need somebody they can go to for hands-on, listen to the heart, do blood work, some things just, have to be seen on site, and so, I do encourage people to have those resources if it's necessary. But I do also really try to empower people to learn what they could, it's, buy a man a fish, they eat for a day, teach a man to fish, and they eat for a lifetime, like that sort of thing. Like, how can I help people evaluate their pet? The weekend diarrhea, dogs got diarrhea on a Saturday night. Well, I don't want everybody running into the ER, and then the dog's put on, metronidazole, Cerenia, and all these drugs, and which makes the gut even less healthy. Whereas if they did probably like a a 24-hour bone broth fast, maybe a little slippery elm or something, dog would be fine. Dogs get diarrhea all the time, but I help them learn what to look for, what's serious enough that, yeah, you got to take the dog in. Hey, they're vomiting 6 times an hour. It might be a foreign body, that's serious, but occasional vomiting, little soft stool here, try, there's some things you can try. People have just gotten so conditioned, I think, in medicine to just run to the doctor. Anytime something's wrong, to run to the doctor, and they don't feel comfortable evaluating their pet and doing some simple things at home. And there's so much people can do at home to help keep their pet healthy and to learn how to do that. Like I said, I want people to be able to take care of their pets on their own and not even come running to me all the time. I want to educate people, and then, get them doing more of these things on their own. And that's, one of my biggest pushes. Like I said, I just started a Substack so that I'm trying to just get a lot of information out there so that people, they understand what in the conventional world, if their pet has a diagnosis such as Cushing's disease or something, what does that mean? Like, what's going on in the body? And so, because people don't even get good explanations these days.
Yeah.
People come to me and they're like, oh, I was told my pet has such and such. And I see, I've been practicing for 35 years. So I've seen a lot of trends in diagnoses, and the latest pancreatitis. Every dog that vomits, or cat even vomits a couple times, well, they got pancreatitis now. My experience, like true pancreatitis, was they were really sick. Like, they almost had to be on IV fluids. They were so inflamed. They couldn't hold down anything orally. Anything they took in orally made them sicker, and they had to be hospitalized. Now I vomit a couple times, and they get this pancreatitis diagnosis. Now they got to be on a low-fat diet. Now they got to be on the prescription diet. I think the testing is messed up in some of these things because there's newer testing now. And I'm like, how are these dogs? I mean, I've seen dogs completely asymptomatic test positive for pancreatitis. Like, okay, these tests have to be, jacked up in some way, manipulated for a desired result. Let's just say it that way.
We have the same thing in how many times, I can't keep track, how many times in human medicine have we seen these levels be manipulated to be higher so that we achieve a diet. When I say we, the population achieves a higher, it's a lower standard for a very serious diagnosis. And so you're on blood pressure medication, yep, or you're pre-diabetic or whatever it may be. They lower the standards.
Yep.
And we see this because they have come out. If you do your research, it's not going to be right there on the front page of the New York Times. It will not be on NBC and ABC. We're not going to be hearing this from Lester Holt. Folks, we have to do our own research. There are lots of mistakes that are being made. And I like the word that you use, trends, that I don't know why this is happening. I don't know why we're learning on the population a lot of these things, but it is happening, and it can happen. So it's at least worth being open to the fact that there might be, for something serious, you might want to get another opinion. And I think, this program that you have, this membership, this could be something that somebody gives you the results and, sends them to you, does a screenshot, sends it to you, and you could give your opinion and say, well, would you ever consider this? Or have you considered the other thing? Great example is like a really good example is thyroid. I only use Dr. Jean Dodd's, I think it's called Gold something. It's a gold panel or something, but it takes way more information into consideration than the standard labs do that most vets will do. And my vet's awesome. Like, he was Holistic Vet of the Year. He's awesome, but he will do the standard test, but he knows the problems with it. If you want to pay a little extra, you could do the gold through Dr. Jean Dodd's. So anyway, I see it's funny how you mentioned the trend. I'm with you 100% on that. It's like nowadays on Instagram, like yeasty pets are a really big, it's like not every pet has yeast overgrowth. Like yeast is part of the package that we need to work. But if it's out of control and a serious issue, I got news for you. It isn't going to be a chew that resolves it.
No, because there's an underlying issue as to why that yeast, show up in the first place. Because yeast is opportunistic. It's all over. It's in the environment. Those yeast spores are everywhere. They take hold when the body's inflamed. So why do we get yeasty ears? Well, if the body's inflamed, say your typical kibble-fed, over-vaccinated pet, body's inflamed, well, then we got the ear canal. That's this warm, moist environment. The yeast love to grow in there. The body's immune system is compromised and they're very inflamed. Well, you just set up this perfect environment for the yeast. But if it's just the yeast we're treating, well, you're going to be treating yeast for the rest of that pet's life if you're not getting to the root cause and focusing on reducing that underlying inflammation. But follow the money. What makes more money for the corporate veterinary clinic? Having a pet on ear meds for the rest of its life and other, probably systemic anti-inflammatories, or changing their diet and getting them healthy and they don't come back to see it for 3 years, and follow the money.
Well, the reaction that some people will have to that is, well, what do you mean follow the money? Companies are entitled to make money. We're not. That's not what we're talking about. We're both for profit. I'm
in business. Yeah,
we're in business.
I gotta make a living. Sure,
we got to make a living. What we're trying to say is that there is a misalignment in motive, and when you have a misalignment, you value certain things and less other things. And so, and again, it's that also it's sometimes not even the money that's 100% of the problem. It's this misalignment of, I'm just not willing to do that much. So I'm just going to throw this at it. And the consumer just isn't, what we pay in exchange for convenience and just to be resolved. I just want to be done with this thing. Itching, pancreatitis, just what do I have to do to make this go away today?
Give me the latest magic bullet. Some people, I think some people come over to the holistic side with that same mentality. And
sure.
I think that's a problem too, or it's not the mindset that's going to get to the root cause. Or like, okay, I don't want to do these pharmaceuticals, but give me the herb that's going to fix this.
Yeah.
And it's the same mentality. They're just reaching for the herb or the supplement rather than the pharmaceutical. But I think it's really important to educate people in that mindset. We're not just treating the symptoms, we're treating the whole pet, and we got to get to the underlying causes of what's going on.
Yeah. 100%. It's, there is a massive paradigm shift that needs to happen, both not just for the vets that you've made clear, but the thing I try to constantly show people in our videos and our shows is it's got to happen on the consumer side, because if the consumer changes, the vets will be forced to change.
Right.
And if the vets, and it's not the reverse. If the vets change, the consumers, if you have the wrong consumers, and we've said this, we've talked about this in your case, you can't have a good relationship that actually resolves issues. If this person's expecting a hammer, where a screwdriver may be more appropriate, it's not going to work. So as consumers, we have all the power. We can talk to our vets. We can encourage our vets to take courses on nutrition. We can encourage our vets to get kibble out of their practice. We can encourage them to look at, really great, less side effect treatments, other modalities to learn. So it's really, I think,
and I think we need some volume of people too, because like one or two people the vets will just say, okay, those are kooky people. They can just go someplace else. If 30% of their clientele is coming to them saying, look, we're going to go someplace else, if you don't start helping us in the manner that we want to be helped and the way that we want to be treated, then they'll take notice. Because I agree, it has to come from the consumer, and to change how vets see things.
Yeah. Well, this has been a wonderful conversation, Dr. Judy. I really appreciate it.
Yep, I've enjoyed it as well. It's always wonderful to talk to like-minded people, because I live in this world, and I'm kind of immersed in it all the time. But there aren't all that many of us out there that really think and live this way. That it's truly how our foundation of how we approach life. I mean, this is how I live my own personal life in my home, and thankfully my husband is on board with the same way of thinking, and it's ingrained in me. It's how I live. It's my truth, and I couldn't live any other way. And so it's true for me, and it's true for how I practice, and I just couldn't imagine doing it any other way. And so it's just so refreshing to talk to other people that have a similar mindset.
Well, we're also local. We're pretty close to each other, so we probably need to get together for a lunch or something.
Okay.
All right, real good. Well, Dr. Judy, to be continued. We'll be doing a follow-up. There's too much to talk about.
Oh,
We'll talk about cancer. We'll talk about a bunch more.
I'd love it. Love to come back.
Great. Well, thank you everybody for watching today, and have a great day.
Thanks, everybody.